My name is Hannah, and I'm a certified nurse midwife. I've been a midwife for years and years. I've delivered hundreds of living babies and also walked with a lot of families through pregnancy loss from 4 weeks to 40 weeks. I've had a front row seat to the very cruelest reality of nature, which is that some babies just don't make it. And over the course of the years in managing these families and walking through this journey, I've developed a frustration over the lack of empathetic care and effective management that we offer. So pregnancy loss is the most common complication of pregnancy itself. 1 in 4 pregnancies end in loss. And even here in Atlanta alone, we see 25,000 miscarriages annually. With something of this magnitude, we just can't ignore giving great care. So you can either present to the emergency department or you can get managed through your OB/GYN office or your OB provider, both of which are fine, but they offer something a little bit different. You absolutely can go to your OB office. They're some of the most empathetic providers that I know, but the difference between that kind of care and the care that we're offering at Haven is assumption. To paint a really good picture of that, think about hospice care. Hospice notoriously is end of life care. That sets a different tone. It drives the type of employee that works there. You often have chapels and gardens and fountains because there's an assumption of loss. There's a sensitivity to the gravity of grief and the potential of lives being lost. And so the assumption at Haven Miscarriage Clinic is the assumption of loss. And that sets a different tone and a different lens through which we deliver care. At an OB/GYN office, there's a lot of different tones there. And one of those tones is happiness, right? Because the majority of babies do make it and we do get to hold them in our arms. So it's very obvious by the atmosphere there. So we see lots of baby pictures on the wall. That's why you get your tote bags and your samples. It's a positive atmosphere, but that's not always the most helpful when it comes to pregnancy loss care. The other side is the emergency room. Now, 75% of miscarriage women go to the emergency room. That being said, only 0.5% of them are actually admitted, and complications are really rare. Not to mention, the emergency room is not the most cost-effective option. So on average, women pay between $3,000 and $7,000 for their miscarriage care. When we are going through a pregnancy loss, our brain is actually changing in response to a traumatic stimuli. So there's a lot of things that happen. There's rewiring that happens. Our executive functioning is impaired. A lot of women experience like a brain fog around that time too. And unfortunately, the early stages of grieving coincides with when we're finding out about loss. And that's when, as providers, that's our expectation for them to be making decisions, which is really unfair to them. So there's a lot of mental health changes that happen, or brain changes that happen when we're grieving. Mental health significantly impacts women, and most women do not receive a referral to see a therapist or mental health practitioner. And unfortunately, pregnancy loss quadruples the rate of suicide within the first year following loss. It doubles the rate of depression. 1 in 5 women experience post-traumatic stress disorder, and it increases our risk of anxiety, both current and then also in subsequent pregnancies and throughout our life. There's a natural tendency towards isolation when we undergo a pregnancy loss. This drift has happened after years and years of shame and stigma and cultural perceptions of pregnancy loss. Some cultures believe that God's punishing a woman for her sins. Some cultures shun ladies, and I'd love to say that that's not the case, but this drift to isolate ourselves does still exist, and women need support immediately to walk them through that process. We have intentionally designed Haven Miscarriage Clinic to fill this gap in miscarriage care. We plan to provide medical services, including ultrasound and lab work, offer genetic screening, follow-up. We are working hard to hopefully offer outpatient surgical management at some point as well. So we've partnered with a lot of other organizations to surround families who are undergoing loss. And then we also developed a mental health program. So every single patient or family who comes into our clinic will receive a free consultation from a therapist, because we so believe that early assessment is key in preventing mental illness in this population. As soon as the clinic came about, we had such an outpouring of love and support. And I truly believe so many people feel like this care is necessary. That being said, we also need funding to make this a reality. We set up the clinic as a nonprofit so that care could be affordable and accessible, and that we could use donations to help subsidize the costs so that everyone could receive this kind of care. Even the most marginalized in our community could receive this kind of care. So we need ambassadors. We need people that believe in us. We need donations. We need companies. We need corporations. We need providers. We need you to make this clinic a reality. Haven was designed to be a place of safety and a place that women can go to feel supported through their miscarriage experience. We want to humanize that experience for everyone. And it's not only a place, but it also was a person. It was a baby that I carried. And we want to keep that close to the heartbeat of the clinic, that this is a person for everyone else who's going through pregnancy loss.